Okay, hello everybody. Thank you for joining us. We're just going to give it a minute for while some more people join. Hopefully you can hear us okay. It's our first time doing a webinar version on Teams and it's a bit confusing, but hopefully it works fine. Oh, thanks for the thumbs up. That's good to know. Okay, we will get started then. So, as I said, thank you very much, everybody, for joining us today for our webinar about the SHAPE project. So my name's Martin Lamb. I'm a senior research fellow based at Sheffield Hallam University in the Advanced Wellbeing Research Centre. And I've been leading this project over the last, 12 months now. And I'm joined by my colleague, Esther. If you want to introduce yourself?
Yep, I'm Esther Carter. I'm the research fellow on the Shaped project. So I work on the day-to-day sort of running of the studies and the reports and things like that. So yep, me and Martin work alongside each other on this project.
Thanks, Esther. And Esther's going to be talking a lot more about the project and what we've done so far in a minute. So just want to acknowledge as well, so other members of the team. So Debbie is part of our team, and also Liam is the PI in the project who are part of on the call as well today. And it is part of a wider group of people. Sorry, I'm just getting my slides. Esther, sorry, do you mind? You're in control. Do you mind going to the next slide? So just to give an overview of what we're going to discuss today. So the SHAPE project is we are looking to develop a service to support children and young people post-cancer treatment. And we've done different work packages. So today we want to give an overview of where we're at with the project, and I'll be giving you some findings around the work we've done with healthcare professionals, insights from families that we've worked with, as well as different community professionals. And then we're also then introduce the next steps for the project and where we're going with the work. Just to let you know, we are going to record the session as we're going along, if that's okay with everybody, just so we can share this with other people. As we're going through as well, feel free to put questions in the chat box, and we will leave hopefully at least 15 minutes to have some conversations, some chats, and ask some questions. So save any questions well for the end, and hopefully we can have some discussions there. And if we go to the next slide, please. So just to acknowledge that this project is funded by Yorkshire Cancer Research. And it's in collaboration with a number of different partners. So ourselves at Sheffield Hallam are the ones leading this, and we're working very closely with Sheffield Children's Hospital on that. And we also have, we're also working with Leeds Children's Hospital and Great North Hospital, which is based up in Newcastle, who are supported on the project. Nifty Fox are the design agency who are on the project. And then we also have colleagues from Newcastle University, the University of Hull and University of Exeter supporting the project. So if we go to the next slide, thank you. Just to give some background, some context as to why we're focusing on this area and doing this work. So every year in the UK, over 1,900 children and over 2,300 young people are diagnosed with cancer. And due to advancements in treatment that are now available, it's approximately 8 in 10 children will now survive their cancer treatment, which is obviously fantastic. However, there are a number of implications that do come alongside this treatment. The treatment can be quite intense. It can be a number of years and can take quite a toll on a person, on a family. And some of those implications include things such as missing school. As I said, it can be a number of years out of school for some children. It can lead to negative physical impact and limitations, potentially amputations, for example. There's obviously the mental and emotional trauma that people go through and families deal with in going through this treatment. During treatment, a number of unhealthy habits, are developed. And because of the treatments as well, there's an increased likelihood of a child or young person developing chronic conditions and potentially developing these earlier on in their life, so therefore reducing their quality of life going forward. However, we do know that if we encourage people to engage in different health behaviours, so if we get people to lead a physically active lifestyle, have a balanced diet, have positive sleep, socialise, etc., this can lead to positive mental and physical health outcomes. Again, there are challenges though to this, and we know from the literature that's already out there, it is reported that families feel there's insufficient support for themselves once their family finishes treatment. We also know that physical activity levels are low within this population. There's poor dietary habits, and there's a high level of health anxiety and fear of reoccurrence due to treatments they've been going through. So therefore, that's why this project has come about, and the aim of this project, therefore, is to co-design a multimodal health behaviour programme for children and young people to support them post-cancer treatment. This is inclusive of all ages, so from 0 to 19, and inclusive of all cancer treatments, and we're specifically focusing on those that are considered in an acute off-treatment phase at the moment. Just very briefly, so to give some theoretical background, this project is underpinned by the behaviour change wheel. And some may or may not be familiar with this, but this is a framework that's used to help design behaviours, interventions to change behaviours. And there's a number of different stages to this. The key stages, and particularly where we're focusing here, but I think what's important with the behaviour change wheel is taking that time to really define and understand the problem that people are facing, and then picking a particular behaviour to focus on and ensure we understand that behaviour before we look to change that behaviour. We know just from other literature and other health behaviours, people typically sort of like to rush that bit and know what needs to be done, but we really want to take that time. As I say, we know it'd be better if people are physically active if they improve their diet, but part of this work as well is understanding where the priorities are for those families and what behaviours we need to be focusing upon in the next support program that we develop. And so to help us design this support program, we've got a number of different work packages. So there's 5 different work packages. Work package 1 is a scope and review of current interventions, which we'll discuss a bit further today. Work package 2 is working with healthcare professionals to understand their experience of supporting families post-cancer treatment. Work package 3 is with children, young people and their parents, carers and wider families to understand as well their experiences, the challenges, their preferences going forward. And then also work package 4 is working with community stakeholders. So these are people who are potentially working for cancer charities or working for with sports clubs, teachers, for instance, guide leaders, looking at their experiences of supporting children and people post-cancer treatment and looking again at where they feel further support is needed. So these first 4 work packages have been completed, and Esther's going to present some of the findings from them today. And we're then using this information to then inform work package 5, which are co-design sessions, which we're going to lead with families to help us design a programme. So I will hand over to Esther, who's going to talk you through some of the findings from the work packages.
Great, thank you. Yep, so I'll go through sort of work packages 1 to 4 and the results that we have for these, and then I'll pass back to Martin for the 5th work package and what we're planning to do with that. So to start with our first work package, this is where we undertook a rapid scoping review of existing health behaviour interventions designed to support children and young people during the post-treatment phase specifically. So we looked for studies that were published between 2000 and 2025 in both academic and grey literature databases. And these studies had to include samples of young people aged 18 and under who had completed cancer treatment, but they could be in any type of health behaviour delivered in any setting. So things around physical activity, diet, mental well-being, social and peer support and education. We wanted it to keep it quite broad to see what was already out there in these areas. So we did screen over 5,000 studies and only 20 met our inclusion criteria. And then out of those 20 interventions, the vast majority of them, so 15, were only focused on physical activity. So then when we were looking at these, we split them into 3 different types that were currently being delivered. So the first type were structured exercise plans. So this is things like your traditional strength and aerobic exercise, and this could have been completed at home or in person. And often children were incentivized through phone call support or online tokens. And then the second grouping were camp-based activities. So this included indoor and outdoor in-person activities and more adventure-based activities, things like team sports, rock climbing, swimming. And then they also had some elements of education workshops and home-based activities alongside these. And then the last type, we had things that used Fitbits, websites or apps that were used to monitor activity levels, so measuring step counts against a goal, and children could collect points and go up levels and collect different prizes. So then only 3 studies within the 20 actually looked at interventions combining physical activity and diet together. So 2 of these used a traffic light system to track healthy eating and activity habits, and 1 used a telephone weight management program. And then the final 2 studies that we looked at were more holistic. So they used an online gaming approach by having activities around exercise, nutrition, oral hygiene, stress management, and sleep quality, but they were a lot less common. So we did see some positive impact though from the studies that do exist. So high feasibility and acceptability rates. We saw the most common improvements were in terms of improving physical activity, which is unsurprising. So improvements in sort of step count, moderate physical activity levels, as well as improvements in quality of life and aerobic fitness. And because a lot of the studies were only based on physical activity, we only had 3 that had diet. Those dietary outcomes were only reported in those 3 studies, and they were quite mixed. So what our review showed is that health behaviour interventions are feasible in paediatric populations, and they can have this positive impact on physical and mental well-being. And then also as part of this, we wanted to try and draw out some of those author reflections about what are good recommendations for future programmes that we can take forward. So this included things like tailoring activities to the needs and interests of children, so involving themselves, children, parents, and multidisciplinary partnerships within the co-design process. It's also important to look at multimodal interventions beyond just purely focused on physical activity. And these interventions should be focused on fun, variety, and also being incentivized. Technology is also an interesting area to look at because this can help improve the personalization of interventions, but we just need to make sure that we're not excluding people who don't have access to technology, and also integrating some form of social support. So involving caregivers, siblings, friends, and peers is also an interesting avenue to have a look at. And then authors also recommended looking at a new programme earlier in survivorship, so in the first 1 to 2 years, where that could possibly have a greater impact on young people. So that is just the summary from our first work package, and we're hoping to publish the more in-depth results at some point soon. So then going on to our second work package, this is when we were actually collecting data from healthcare professionals who have experience working with children and young people with cancer. So the aim of this was to understand what support they are currently able to provide, their preferences for a future support programme, and also any barriers and facilitators that they found in terms of delivering support, but also their perceived barriers for children and young people and their families accessing this support. So to do this, we had 2 types of data collection. We had some online surveys, so we got 79 responses from healthcare professionals working in the NHS, and then we also did follow-up interviews where possible, so we managed to do this with 15 of our participants. So for the surveys to start with, we felt like we had a good mix of respondents. So we had them across different job categories, and we saw quite high numbers as well from nursing, medical, and therapy job roles. And then in terms of what health behaviours our respondents were supporting, the only area that was supported by at least half of the participants was around mental well-being, and the least common area that was supported was around peer support. We also asked them about things like family support, physical activity, and diet as well. But a lot of these health behaviour supports that we're specifically looking at were more commonly delivered by those that had 10 or more years of experience within healthcare. And then we also wanted to understand what healthcare professionals thought were missing or could be changed in the future. So we gave them a list of potential priorities for a future programme. And the most commonly selected were around mental well-being, physical activity, and being able to manage fatigue. Healthcare professionals also wanted to see more sessions available for family, again, that were multimodal, so around diet, physical activity, mental well-being, that were led by professionals to educate families in these areas, as well as offering some more peer support for children, helping them get back into school, and also some more financial support for the wider family was also suggested by this group. And then when we look at the interviews, again, we had quite a mix of job roles in our interviews. We did have quite a few from nursing backgrounds, but all of these individuals did have different job roles, so they came from different angles. So we got lots of different insights from these interviews. So we created 4 main themes around those research questions that I spoke about at the start, but the 2 I'm mainly going to focus on today are around those motivators and barriers for a new support programme. So this first part is about the motivators and barriers for healthcare professionals in delivering support. And as Martin said at the start, we've been structuring things around theoretical models. So we use the COM-B model for this. And some of these motivators and barriers that were discussed, so around the capability, this centered around healthcare professionals' abilities to provide support. And this was mainly focused on a lack of formal training opportunities, specifically around health behaviour change in paediatric populations. So that seemed to be an area for sort of future concern. And then within opportunity, healthcare professionals often rely on support from other colleagues to help them deliver this health behaviour support, especially when that formal training in the area isn't available. And then healthcare professionals, we sort of touched on it at the start as well, but they reported that the unhealthy habits formed by children during treatment can make engagement in these health behaviours difficult. So this is things like having extended screen time during treatment, and healthy eating habits where children are focused on just increasing calories, but then maybe struggling to return to a normal diet afterwards, as you can see on the quote on the screen, and then potentially being sedentary as well during treatment. And then also, unsurprisingly, a lack of resources and capacity or clinical space can make delivery from healthcare professionals very challenging. So we had people saying they might only see a young person once a year, or for people working in late effects, they might only see people 2 to 5 years after treatment. And then it could be really difficult to sort of break down those unhealthy habits that have been built in that time. And then lastly, in terms of motivation, healthcare professionals reported that some health behaviours like supported diet, mental wellbeing, physical activity felt like it actually conflicted with the scope of their job role. And then that lack of training that we spoke about also seemed to have a negative impact on their belief in their abilities to be able to support children in their health behaviour change. But we also did find that healthcare professionals being able to develop strong and positive relationships with families can help them overcome some of these barriers around confidence and also discussing unhealthy habits. So then we also followed this similar approach by theming the perceived motivators for children and young people. So a common barrier that we saw was this negative physical impact of cancer treatment, particularly on fatigue, growth differences, weight fluctuations, mobility challenges. And then we also saw that the psychological resilience of children can then motivate engagement in health behaviours, and that can potentially help them to overcome some of those challenges they face post-treatment. And then it was also important as well to consider the influence of the social support system, so positive and negative. So fear from parents or siblings could prevent children from engaging in typical school activities or physical activity, but allowing children to engage in activities alongside the support from families and siblings and peers could motivate engagement. Support that is person-centered as well can also motivate engagement, so making sure that the support is timely within their cancer treatment recovery phase, in line with key events like transitioning from primary school to secondary school, and also having a variety of sort of online and in-person formats and different activities, so they have the autonomy to choose how to take part. And then also that motivation to engage can be influenced, as we said, by that psychological impact of cancer. So that fear and anxiety around returning to typical activities or trying something new. And also that ability to try these activities can be affected by the need to keep revisiting hospital for follow-up appointments, which healthcare professionals felt could bring up memories of sort of traumatic experiences. But positively, allowing children to understand and see those benefits of engaging in health behaviours could motivate them to engage in these healthier lifestyles. So just to summarise some of the key findings from this, we found that healthcare professionals often provide the support through referrals to other specialists or charities, potentially due to the issues around lack of time and capacity. Mental health was the most commonly supported area, but it was also highlighted as one of the areas of greatest unmet need. And in general, healthcare professionals wanted to see more support around peer and family support, education, diet and physical activity. And then also the delivery of this support can be impacted by lack of formal training opportunities for professionals, and also those unhealthy habits that have been formed during treatment, and the negative physical and psychological impact of treatment and how that limits children's engagement. So we just wanted to pull out some of the key considerations for ourselves going forward to design a new programme. So again, because there's so many areas of unmet need, having a more multimodal programme incorporating different areas seems more appropriate. Also making sure these programmes are person-centred and family-centred, so accounting for those individual needs and preferences, but also accessibility constraints around the family. And as we said as well, involving families in co-design and also having more community or home-based delivery could make future interventions more accessible for families. And also, as we said, there is this gap for more training opportunities for healthcare professionals, specifically around behaviour change, as well as behaviour change in more paediatric populations. So those were our findings from the healthcare professionals. And then one of our larger work packages is this work package 3, which is about getting insights directly from children and young people and their caregivers. So again, we had fairly similar aims, which were to understand their lived experiences of post-treatment support, preferences for a future support programme, and also barriers and facilitators. So to do this, we had 3 different approaches we wanted to take. So the first approach was using these creative ideas kits that were sent out to children with activity sheets so they could complete them, tell us about what they enjoyed and didn't enjoy in their experiences. And that was a nice way just to get them involved in the research. And then we paired this where possible with some follow-up interviews. So we did this with children and their parents so they could give us more details about what they created in their ideas kits. And then we also had some separate surveys that were just for parents to, again, explore experience and preferences from their perspectives. So we had the help of our clinical teams to try and recruit families. And as part of this, we also had a video that we showed to families about the research project, which was created by Nifty Fox, again, just to try and better engage families with the research and get them involved. And then we also worked with Lab for Living at Sheffield Hallam University, and we came up with these ideas kits that were posted directly to families, and there were 5 different activity sheets for them to complete, and they could send them back to us free of charge, or they could take pictures. And we did pilot these with children of different ages and adjusted them based on feedback. And then we also had 2 different versions that we sent out. One that was a bit more structured, maybe for sort of an older age range or people that liked a little bit more structure in how they were filling it out. And then one that had a bit more creative designs just to suit different developmental needs and interests. So this is just an example of one of the kits. So we started out with a brief introduction sheet, and then we had 5 different worksheets. And also within the kits, we had coloured pencils, pens and stickers that children could use. So we had sheets where we asked children to tell them a bit more about themselves, what they get up to in a typical day and also a typical week. And then we also got them to map out things that happen throughout the year that are important to them. And then the final sheet was getting them to look to the future about what they would like to do when they're older and how they could be better supported to reach these goals. So I've got a few examples of how people have completed these. So this is some examples from that first page about when children can tell us about themselves. So we had some quite nice drawings of their families and friends, and also learning a little bit more about their hobbies and dreams. So one of the children here dreamt about being a policeman, so he drew that for us, which was great. And then on the second sheet, which was more about the day in the life of the person, this person did a nice breakdown for us about what they do on a weekday and on a weekend. So they had lots of different musical hobbies on there, which is great. But then what was interesting within that, they also discussed issues with feeling fatigued during school days, and also the need to rely on their friends during school. So walking around the atrium, trying to find their friends because they have limited vision. So again, that was coming out nicely from this activity sheet. And then the other one on there is about a week in the life. So again, this child had very varied interests and hobbies: drums lessons, scouts, swimming, football, computer club. But then what we really liked from this one is that they used one of the emoji stickers to tell us how they were feeling about having infusions every Saturday as part of their sort of post-treatment medication. So that again showed us how they were feeling about different parts of their schedules. And then in terms of what people do throughout the year, often children detailed how they still had regular hospital appointments, medication use, and we usually saw these accompanied with those emoji stickers, which were usually unhappy faces, but then spending time with friends and family and being in school was really important to them. And then one of these sheets also showed how they enjoyed meeting other people with cancer experiences. And we also saw a few times where families are celebrating end of treatment anniversaries as part of yearly activities. And then the final examples are just from those sheets looking to the future. And these are some nice examples from some older participants we had. So the first one shows very typical adult activities that they want to enjoy, like owning their own home, driving, going on holiday, having a career in an area they're interested in, rather than being linked to cancer treatment. But then the second example from the 19-year-old shows future goals that are very much linked to their experiences of cancer treatment. So them wanting to work with children and young people to support their well-being, sharing their own experiences to raise awareness and early identification of symptoms, joining more groups for cancer survivors, trying to reduce stigma around disability. And also what was nice is that they wanted to work for charities that they'd been a part of, like Ocean Youth Trust and Ellen MacArthur, after having their own positive experiences. So this really shows that diverse needs of children and young people. So then we also had online surveys for caregivers. So the ideas kits were just for young people and the surveys just for caregivers. And again, we had over 400 responses across a good spread of diagnoses. And we asked caregivers to identify their top 3 motivators and barriers that they felt would be there for their child engaging in a new programme. And often their top motivators were around having support from families, healthcare professionals, and also some online rewards and prizes. Whereas on the flip side, the top barriers, again, were related to fatigue, lack of mental well-being, and a lack of confidence. And then the final part of this work package was to do these interviews, and often we had children alongside their caregivers to expand on ideas from the ideas kits and surveys. So we had these 4 research idea areas. So the first one was around the current context of post-treatment support. So families often discussed issues relating about transitioning from being on treatment to off treatment. So whilst they were on treatment, they're receiving regular care, which is delivered by trained staff. But after treatment, families reported this drop-off in support or perceived drop-off in support, even though their child still needed a lot of help. And then also children themselves reported high levels of anxiety about returning to school, feeling behind, feeling nervous about seeing their friends again, or lack of confidence after losing hair or weight changes. And we saw in the ideas kits as well, but children still having a lot of follow-up appointments, continued medication use, and this can interrupt their return to full-time school and make it difficult for them to move on properly and get back to those typical activities. And then in terms of post-treatment support, children, as we could see from those ideas kits, were engaging in a variety of different hobbies and interests, so team sports, swimming, cycling, but also creative activities were really important, especially for those who were struggling to get back into physical activity, and it was seen as quite a therapeutic activity. Education support was also vital, so having tutoring or additional resources were vital to get children back into school and their typical routines, and sometimes this was delivered by external charities that they really appreciated as well. But then when we're looking at what was missing or what families wanted more support around, again, it was things like mental well-being, physical activity, and also how to be more motivated to eat healthier food, and also access to more physiotherapy sessions. Again, there was more interest in sessions being tailored to the age and interest of children, and also the stage of recovery that they were at. From parents in particular, they wanted more information about late effects that their children might be going through so they can help their children understand that, but also something that was then available for teachers so that transition back into school would be a lot easier. Parents also wanted an accessible list of local activities that they could take their children to, having often missed this from while their child was on treatment, and then also more support for siblings who had also been impacted by treatment. And then also in terms of the barriers and facilitators for accessing support. So again, one of the big comments that were coming out from families were around the ongoing negative impact of treatment. So those physical changes around fatigue, vision impairments, range of movement changes, lots of changes in eating habits as well, and also difficulties engaging in daily activities, so writing or socialising in friends. So families can help to prevent or drive engagement in health behaviours, and the accessibility of these activities can also motivate or hinder engagement. And what was good to see was that children also reported a positive perception of being around peers with cancer experiences, and that actually could motivate them to better engage with programmes in the future. And then finally, again, sort of barriers and facilitators. The families within our interviews had very positive experiences of the psychosocial and family support opportunities that they had received from charities, but they also did highlight some of the additional barriers that they faced to accessing these. So things around parental fear, logistical barriers, and then also children having or expressing challenges that they felt like they couldn't perform at a similar level as they did before they had treatment. So that might prevent them from wanting to take part in new activities. So just to round off this work package, again, some of the common challenges that we found were around fatigue, mental well-being, and that struggle transitioning from on treatment to off treatment. And current support is very varied, but returning to school is a key milestone. And then in the future, families want to see a varied support programme that is child-centred and age-appropriate, but more support is needed for the people around children, young people as well, so their parents, siblings, and also their schools to help them transition better. And then the last work package is about exploring similar research questions around current practice, future support and motivators and barriers, but from the perspective of community stakeholders. So we did this through 10 interviews and included anyone with experience supporting children who had had cancer. So this has ended up being split into 2 different groups. So we had those who specialise in supporting those with cancer, and then also those who worked in the community, but not necessarily related to treatment of cancer. So things like teachers, physiotherapists, occupational therapists who might have only had 1 or 2 children come through that have had cancer experiences. So again, we covered 4 areas, but I'm just going to focus on a couple of these. So some of the areas where they thought more support could be provided in the future, again, was around mental health. So things around health anxiety, that loss of identity, overcoming some of the trauma associated with treatment. More support again for the whole family. So siblings, parents, but also raising awareness of what existing opportunities are already out there, as charities are doing amazing work with these groups, but also how to access different support opportunities. And then also this support again needs to be person-centred, so having a variety of activities, different modes of delivery, online, in person, that children can choose from. And then this group also saw some similar motivators and barriers around poor mental well-being and how this can be exacerbated by a lack of that psychological support that's available. Families facing challenges in accessing support, so we need to make sure that they have this suitable and relevant support that's easy for them to access. Whether children are receiving peer or family support as well can motivate or hinder engagement, and then also whether these sessions are appealing to different ages and whether they can be adaptable to different needs. And again, those logistical barriers around geography, so groups being widely dispersed, lack of time, things only being available in English language, and also whether people have access to appropriate technology. So again, just to briefly summarise our main findings from this work package. So we found that the community support, even though the sort of number of interviews might have been on the lower side, the support just from these groups was very varied. So things across physical activity, education, social support, play and talking therapy. And often this support focused on creating a sense of normality and building life skills. But these community stakeholders did identify that there are gaps in supporting mental well-being, and there also is a need for more interventions that are tailored to the individual needs and focus on fun. And also, similarly to healthcare professionals, community stakeholders are interested in more specific training around late effects and behaviour change, as well as having this hub of resources that they could then refer families into. So we have discussed some things that are common across different work packages. So just to summarise those that we've seen across work packages 1 to 4 is that idea of a perceived drop-off in support experienced by children and families as they move from being on treatment to off treatment. that real need for multimodal support programs. So integrating areas of unmet need around mental well-being, physical activity, healthy eating, reintegration into schools, and also peer support from those with and without cancer experiences, and also something that can be adaptable to the interests and needs of children, and also something that can be engaged with by the whole family, as parents and siblings also experience a lot of difficulties post-treatment. So involving these families in co-designing a new support program might help tailor new activities to their needs. And also there is this idea of having more formal training opportunities and this hub of resources of existing support opportunities that are available to both healthcare professionals and community stakeholders to support in that transition. So I'll just pass back over to Martin about our final work package.
Thanks, Esther. Yeah, so I'll just briefly finish by talking about the next steps and where we're going with this work. So, as I said, so we've got work package 1 to 4 now, and we're going to, these can be used to inform work package 5, which are co-design work sessions. So, the plan here is to conduct 3 co-design workshops. Sorry, Esther, if you click on for the information, please. Thank you. And in these workshops, we're going to invite children, young people, their parents, carers, as well as siblings, healthcare professionals that are involved, and also any other community stakeholders. So we want a range of different voices, a range of different people in those workshops to give some different views and start helping us design what this program could look like. The workshops are going to be led by Lab for Living again, so who helped us support us with the ideas kits. So they have a lot of experience in delivering these co-design workshops. They're also obviously a bit more independent to the research, so we'll offer a more a better view on the project. And as it stands, we're still in the process of finalising the workshops, but topics that we'll cover include things such as defining what a healthier normal looks like, because we appreciate, this normal for one person is very different for other people. So understanding what that looks like for different people, and how we can come to potentially a common definition of that. We'll then ask the stakeholders and the people involved in the session to actually help us analyze some of the data. And I know Lab for Living have got some really creative ideas in terms of using illustration cards, etc., and using stories so we can really understand the experiences of people, and form another form of analysis on top of that. From this work, we'll then start to look at where we should be prioritising, what a future support programme should look like, and generating new ideas. Again, this will be very much led by the people in the room. And then the idea is we'll have a number of different ideas suggested, and we'll potentially pitch them to the funder within the workshops to get some ideas, a bit of a Dragon's Den situation, and get some feedback, and hopefully come away from these workshops with some key tangibles that we know we need to involve in a future work package or a future support program. And I think what the key outcome really as well from this work, from these workshops and this work package, is for us to develop a logic model. So it's essentially is a blueprint of what a service will look like, particularly drawing upon like behaviour change theory, drawing upon the practicalities of how that will work, what a support program needs to be doing, how it needs to be supporting families. As I said, so the 3 different workshops are going to be held over the next couple of months, and we're doing them in different locations. So we've got one in September in Sheffield, one then in Leeds, and the third one will be online. So we've got a number of people already signed up, but if there's anybody that is interested and feel they've got something to contribute, please get in touch with us. You're more than welcome. We can try and facilitate you coming along to those sessions. And then just finally, so the next steps for the project. So as you said, we've got the co-design sessions and the workshops that we'll be delivering in the next couple of months, and we'll hope to have the project wrapped up by the end of the year. As I said, we'll then be using that data to design what a new support service will look like, support program will look like, and we'll be then looking to test the feasibility of that and looking for funding to look at how we can implement that, with working alongside families potentially within charity sector or within the NHS. So that is an overview of where we're at with the project. So really appreciate you all staying and listening. I'll open the floor to questions. I guess just to say, if anyone wants to get in touch, we've got a website and we've got our contact details here as well. We will also share the recording and our details after the webinar with people. So please feel free to forward it on to colleagues, people you feel that would be interested, or if you've got any questions or anything you want to follow up on, please do get in touch. But at this point, we'll leave it there. I'll switch the slides off. But if anyone's got any questions, please feel free to either pop them in the chat, or you can raise your hand. Hopefully people come switch their microphones on and ask them if that's easier. Just let us know. Alison. Alison, sorry, we can't hear you. I don't know if you can switch your mic on. Or maybe pop your question in the chat. This is always the problem with doing things online. Something goes wrong. Can't turn your mics on. Okay. I wonder if we can turn your mics on. Bear with me. No. We've got you all muted, I'm afraid. So sorry, Alison, if you have got a question, are you okay to pop it in the chat? So how are we planning on making this available? So we will look to, as I guess all academics, we will look to write these up as publications and we'll have the reports. I think what's really important as well, though, is we do want to try and share it in more accessible ways rather than it sitting in a publication that nobody reads. So we'll hopefully look to do more of these sessions, presenting at conferences, etc. I guess, I'll be honest, we're open to suggestions. If people feel there are better ways to reach different people, please let us know how we can be reaching different people, because we know it's key and really important to make sure we get this information back out to the stakeholders we've obviously involved, to different healthcare professionals, different community stakeholders. So yeah, we'll look to use a different variety of methods, but we're open to suggestions. We are also working with, as we mentioned, Nifty Fox, our designers. So they're going to be creating an animation and a couple of infographics to share some of the final outputs. So that's something we'll be looking to share as well with people. So thank you for that, Alison. Varys, let me read your message. So yeah, Verity, so in terms of who's going to be delivering it, I think that's still a discussion for us to have, really. I think we've heard a lot, and Esther, feel free to chip in and correct me if I'm wrong, in work package 2 from healthcare professionals and healthcare professionals on the call will probably agree. There's a lack of resources, a lack of time capacity. Everybody is doing above and beyond as it is. So I think that's something we still need to determine is the practicalities of this. So I think we're starting to understand what the support needs to look like, but then in terms of the actual delivery, that's sort of the next step, and that's what we want to understand from the co-design workshops. So that's involving different stakeholders. So yeah, are healthcare professionals the best ones to do that, or are they better to be signposting it to potentially a community organisation or something again that sits outside of the NHS? We also want to explore, again, within the co-design sessions, from a young person's perspective, who are they going to listen to ultimately? Who do they want to be sharing that information? It may be that they've, also, for some of the families we spoke to, they want to kind of move on from the cancer journey and they want to move on from the healthcare setting, and they try not to associate too much with that. So again, that's something we also need to determine and understand from the families that we want to use the program, is who is best placed to support that. Sort of a term we use is this idea of sort of a credible source. Who do people believe? Is that I'm not saying we'll do this. Is it an influencer? Is it someone like that? Is it a teacher, a friend, a colleague? Is it a peer that's also been through the cancer journey to do that? So that's something that's still being explored. You imagine it'll probably be a combination of all, but we also need to work within the pragmatics or practicalities of the NHS to make something work if that's the case. Has anybody else any more questions? If not, we shall maybe leave it there. Appreciate it's lunchtime, so people probably got other priorities right now. But I guess just finally, just to say again, thank you very much for attending, and say please keep in touch with us, and we'll hopefully be sharing some of the findings as well with everybody. So yeah, thank you very much for your time.